So we have a special guest over here. Okay. So originally you came to me for what? You've been having some headaches from time to time. Is that right?
Yeah.
You might point to me. Where do you feel the headaches?
Right here.
Okay. You also mentioned that you've been having scoliosis as a child too. Okay. All right. So we're going to take a closer look, see what's going on, and also how the scoliosis impacts and affects her headaches as well. All right. So right now we're doing instrumentation, and we're looking for any signs of inflammation. So one of the byproducts is abnormal temperature, and also part of the visualization, and that's what I'm doing at the same time while I'm doing instrumentation, is looking for any signs of swelling. So we found one level right over here. And also, we're scanning along the curvature of our spine. We found another reading over here. Since she's petite, do have to narrow down the probes a bit. There it is, with a smaller reading here. And another small little reading up there as well. Bring your head down a little bit. Thank you. And a slight little reading at the very top. And take a look what's going on in the foundation. I do see a swelling right on here. So tender right here? Yeah. So usually when there's swelling surrounding a sacroiliac joint, that's a pretty good indication that it warrants a closer look. See, I don't see or feel any swelling over here either. So now we're going to check. Now normal, it should move. Abnormal is stuck, fixation. So your right hip, the right sacroiliac joint, that's moving and pivoting just fine. We take a closer look at your left one. See that? It's not moving whatsoever on the left ilium over here. You feel that right there? So you can move it forward, doesn't move backwards. Swelling on the bottom part, pain here?
Not a little bit.
Right there, huh? Yeah. We'll take a closer look on the x-ray, see what's going on that left hip over there. Okay, that's fine. I'm gonna check how everything's moving. Yeah. See that? It's stuck right there. It's not moving too well. I'm gonna mark this level. We'll keep an eye on this one as well. Tender right there? You have a little swelling here too.
Yeah, I feel that.
See this one over here? You got a bigger knot over here on the left-hand side, and a tiny one on the right-hand side. So now we check every single bone. How's that fella right there?
Hurts.
Yeah, see? This fella over here, that's in trouble. See, it doesn't tilt. It doesn't move too well. It's supposed to move in all directions. All right, we got that one over there. Let's see what else is going on. Okay, very slight up there. Very, very slight. Ah, you feel that fella right there, huh? Okay, so we got some swelling on the right-hand side. Okay, let's test. So there's very slight fixations you have. Just a little bit. But it's not that bad. The same thing as well. For your occiput, it's also slightly fixated, but it's not that bad. All right, x-ray time. So even though you're complaining about headaches from time to time, especially the front part, okay, typically there's a muscle that travels all the way from the shoulders and it wraps around the band to the front part over here. Right? So when I think about that way, I'm considering this as okay, what's going on in terms of the structures over here? We do find some potential problem over here at this sixth circle and the fifth circle. These two fellows, they're in a bit of a trouble over here because we do see that this space over here is quite enlarged. Right? And we tested this fella. He says, okay, that's not so fun and uncomfortable. There's some swelling, okay, and muscle spasm in that area. But even though I correct this fellow over here, it's not going to stay put too long because it's sitting on top of a very unstable foundation. So when we take a look over here, as you see, yeah, you've got scoliosis, no doubt about that. It's swinging over to the left, right, and left again. So when we test your foundation itself, this helps explain a lot of things. As we see over here, it's much more wider over here, much more narrow over here. And we also see the gluteal fold shadow over here is supposed to be smack in the middle over here, but it went all the way to the left. So what that tells us is that the whole time tells us it did this, right? Now, last time I checked, I don't think you can walk this way, correct?
Yeah.
So our head has to be here, and even though our body is twisted this way, our body has to start adapting and start twisting. So it's going to start twisting this way, keep on twisting over here, but it can't just stop this way. It's going to keep on moving. Our head still has to be in the middle, so it's going to start twisting over here, here, and here, and then finally here. So that's what we're seeing over here. Areas twisting this way, this way, this way, this way. It's a very subtle twist on the top part over here. But this is the fella that started the whole entire domino effect from the very get-go. Now, I'm not saying that we can make this fella straight as a rod. It's just not going to happen. It's just a little late for that. Now, if you came and saw me 10, 15 years ago, especially 10 years ago, that's like pretty much right at the crucial point, we could possibly do something about it, all right, to minimize a lot of that rotation, right? But now at your mid-20s, right, your body has already adapted to all the changes over here. And it's going to be very difficult to try to straighten out. We could help reduce it quite a bit, but to make that thing straight as a ruler, no, that's a really done deal. So what we're going to do in today's visit, we're going to correct this one. I'm going to double check what's going on here and with that neck as well. All right, let's roll. The strategy correcting on this one, so for the Gonstead students and doctors, the reason why we did a push maneuver on this one and not a pull maneuver is because all the vertebrae, all of it, is rotated to the right. So if I did a pull maneuver, it's going to make the lumbar spine even more rotated to the right. Whereas when we did a push maneuver over here, we're knocking out two birds, one stone. Not only would it correct this left ilium over here in proper alignment, we're also going to nudge a little more the lumbar spines more into the proper alignment as well. Let's go. Okay, come on up.
Oh. I feel a little different, kind of.
What do you feel different?
I don't know, but it feels a little weird when I walk. Not like in a good way though.
Keep walking around.
I feel like my spine kind of shifted. Is that what it is? I think so. That's what I kind of feel like in the middle.
Can you say again? What do you feel that changed?
My spine shifted.
Mm-hmm. Anything else?
I think that's it.
Okay.
Yeah.
Anything else you notice with your shoulders or your neck?
Oh yeah, they feel like they went down a little. They weren't like, because before I felt like they were tighter,
Mm-hmm.
and I feel like they kind of went down. Yeah.
Okay, so how much of a difference you notice so far? Your shoulders and your neck?
Big difference.
Well, throw me a number. What? 30%, 40, 50, 60, 70?
Like 60%?
60%.
Mm-hmm.
Okay. That's quite a big difference.
Yeah.
Right? We didn't even touch anything else. So that's what we mentioned about before. Working on the foundation and just restoring the biomechanics to it can help alleviate a lot of tension over there. My shoulders. A little more. Right? Good.
feel like I walk straighter now.
Say again?
Like, I feel like I walk straighter now. Like,
Nice.
before I felt like a slouch here, now I feel like straighter.
That's great.
Mm-hmm.
All right, have a seat. So how's it feel right now for your shoulders and your neck?
Good. They feel a lot better.
Good. How much better would you say right now?
Like 70% better.
That's great. Just relax. A little more. Just relax. A little more. A little more. Now, on the future visit, you let us know. Keep us apprised. How's your headaches? How's the tension over here? So on and so forth.
Mm-hmm.
All right? Any other questions?
No.
Okay. All right. It's a pleasure. See you next visit.
Okay.
Have a good one.
You too.
Brings up to speed. How's everything doing so far?
Everything is good.
Okay. How's the headaches?
There are no more headaches.
Not a single one?
Mm-mm,
Hey,
not
I didn't
all
like
of it.
that, huh?
It's good.
All right. And how's your overall posture?
I feel like it's getting better. I don't feel like I don't slouch as much.
Uh-huh.
Because usually my shoulders would go in, but now I feel like I could control them.
All right. Well, thanks for the updates. Round 2. Instrumentation. Once again, we're looking for any abnormal temperature. Found one at that level. And because she has scoliosis, we're following on the track of her spine. Okay, reading's improving. We have a reading here as well. See that, fella? It's still jammed up. That's not moving. See your right side? That moves. Left one, it's still stuck. So this is still a work in progress. We're going to address that, fella.
Mm-hmm.
That right there, that's also jammed up. We're going to correct that one too. 6 dorsal. Sit back, please. Relax the hands. Swelling is improving.
Oh, good.
Yeah. That right there is still fixated. You still have some trouble tilting there.
Mm-hmm.
Tilting and rotating. 6 cervical. All right, let's get to work. Well, just go shoulder. Splendid. Come on up, please. Okay, just relax this over here. Let it all go. Just relax. Ooh, that was a beauty. Okay, relax shoulders. Now we do have to lower this piece over here, so over here she can relax more. That would make a much more easier, deeper set for her neck here. Let it go. Oh, there's a piece. Let it go. Let it go. Ooh, there it is.
I feel better.
Good. What other difference are you noticing?
Like less pressure. Like here.
Good. Anything else?
And here too. Like in the back. There's less pressure.
Good. How's the shoulders?
Like down.
Nice. How you loving it?
I like it.
Well, it's always a pleasure, right? And as I mentioned before, everything else is going to be a work in progress, right? Because we got to keep on retraining that foundation of yours, because that's your old major problem there,
Mm-hmm.
right? Right? It's been a pleasure. See you next time.
See ya.